Glad to have you back if you've been watching the latest edition of Know the Facts with Dr. Claremont. The first half hour was very, very interesting. Now we're going to enter the second half hour. And Dr. Claremont's got some very, very, very interesting things to talk about. And I still hope you're watching, and I still hope you've got your pencil and pad in hand. Welcome back, Dr.
Okay,
Claremont.
nice to be back again. I hope I'm not speaking too much, but there's a lot of things that go on when you age that are normal. And that's really what I'm after, is trying to point out, when do you call the doctor? When is it abnormal? So let's do. We're trying to talk now about skin. A lot of changes happen in the skin. Remember when we started out the program, we talked about the appearance. You can tell from the appearance of somebody, boy, you look old, you know, that type of deal. Well, you're seeing the skin. Now, for some reason, I don't know why, men don't like to moisturize their skin. They don't like to use these products on their skin. I don't know why. Women's skin tends to be a little softer even as they age, but there's still changes that occur in the skin. But the men, it occurs faster because they haven't moisturized. Plus, they're outside getting these UV rays all the time, getting that good tan, and then they pay for it later. Let's talk a little bit about what happens in the skin. You lose the elasticity under the skin. You lose the fat under the skin. The skin now is thinner. When you lose that fat, what happens is you cannot regulate your temperature as well. You're very susceptible to the two extremes of temperature, high and low. We had mentioned that thermoregulatory thing before. So you got to be very careful. Cover up. Cover up. You need to. You need to protect what you have left. And men, damn it, use the moisturizer on your skin. Nothing wrong with that. You're going to help preserve it. We also get a lot of changes in the skin too. We call them age spots. You know, like age is a disease, you know. It isn't a disease, let's face it. But there are spots that do occur. You may get little, what they call nevi. Those are little brownish areas in the skin. You may get cherry spots, little capillaries that come up into the skin. You may get things that look like a cow pod. You know what a pod is. You remember, I gotta tell you this. We had cow chip throwing contests when I was in the Navy, because there were a lot of people who happened to be with us who were from Oklahoma. Of course, they had their ranches and all. And they used to have cow chip throwing contests, sort of like a Frisbee type thing, you know. Who could throw it the furthest? Well, it looks like a cow pod. That can happen too on your skin. There's also bad things that can happen. You can get little basal cell or squamous cell cancers. The only really, well, the worst bad, the bad one, is called a melanoma. What do you look for? You look for dark and light, in other words, variable color. You look at the border around it, and it's irregular. It's not a nice, smooth, round, or whatever border. There's irregularity in the border. It may even bleed a little bit in spots if you scratch it. That's what you look for. And finally, there's change, there's growth. It gets a little bit bigger. The first thing I do when I look at a lesion on the skin is I'll feel the skin. Very gently, just feel it. Is the skin thicker? If the skin is thicker with this lesion, you need to see a dermatologist. The only issue with dermatology is that they tend to drag stuff out horribly. They'll take a little biopsy. But it was just a little thing. Why'd you just take a biopsy? Why did you take the whole damn thing out? No, we got to do the biopsy. And then you'll wait. And then you'll wait some more. And then finally they'll want to just, we'll use some medicine to try to get that thing taken out. I usually myself, I go to a plastic surgeon, take the damn thing out. If it's a basal or a squamous cell cancer, it's usually cured. If it's a melanoma, they know how much to take out, hopefully to give you a cure. That's what you look for in the skin, abnormalities like that. Okay, what else can happen? Well, let's go on to the different systems in the body. Let's say, we talked a little bit about the lung already, so I'm not going to mention that. The heart, what about the heart? What can happen there? Well, obviously, heart attack. That's the worst thing that can happen. That can kill you. How do you know if you're having a heart attack? Well, generally men have chest pain. And with that chest pain, they get shortness of breath. They look pale. Maybe they describe people as grayish appearing. You feel their pulse, it's very, very weak. They call that a thready pulse. Right to the hospital. Pop that aspirin in right away. That's the very first thing you do. You want to prevent that heart attack from extending and becoming larger. Pop that aspirin right away. Get into the hospital immediately. Women don't tend to have chest pain. Women may have unusual symptoms. They may have jaw pain, shoulder pain, back pain, unusual pain. But when something comes up that's never been there before, and there's a pain, needs to be looked into. There's no age at which you don't worry about chest pain. Yes, it may have a lot of negative chest pains. In other words, anxiety and all can have a bad chest pain because of anxiety. So what? You want to protect yourself, you get to see somebody, have that cardiogram, have those enzymes drawn in the blood. Make sure it's not a heart attack. We had mentioned before about too fast, too slow, and irregular heart rate. All those things are part of seeing a doctor. If you get it into the 40s for a pulse rate, too slow. If you get it into the 120s, too fast. Irregular, not regular heartbeat, right in. You don't take any chances with these. Okay, that's the heart. Okay, talk about the GI tract now. That's a pretty long system. It goes all the way from the mouth to the butt. Different things can happen along the way. First of all, the esophagus, that tube that goes from the mouth into the stomach. A lot of heartburn out there. If heartburn is untreated, it scars the lower portion of that esophagus. So you may have trouble getting solid food through. That's called a stenosis. They have to dilate that to get that reopened again. So if you're having trouble getting food through, you need to see the doctor. What else? You have an increased chance of cancer of the esophagus with untreated reflux. That's a reason for you to be treated for your reflux esophagitis. That just means that the acid from the stomach is coming up into the esophagus. Shouldn't do that. There's a sphincter there. That should hold it down. If it doesn't, needs to be looked at and treated. Talk about the stomach now. Anytime you see black stools, black poop, basically, that means most of the time blood that's been digested in your intestinal tract. Not all the time. Could be due to medicine. Pepto-Bismol is a very common reason for black stools. But if I had a black stool, I want my stool tested to see if it's blood or not. Usually by the time it starts in the stomach and gets all the way down to poop, it turns black. So black stool, stomach, maybe an ulcer or something, or gastritis, you need to be concerned about that. If you have an ulcer, usually it's very pinpoint pain. It won't go away. Gets a little better with food, but comes right back again. So pain that is immediately in one spot, you need to think about ulcer. Okay. Gallbladder. We get stones, cholesterol stones in our gallbladder, or calcium stones. Where does that cause pain? Right side, up under the rib cage, or in the back. Goes right through. Sometimes you may even get pain up in the shoulder. Need to have somebody look at it. Again, pain that's in a very specific spot needs to be looked at. What sort of things happen in the small intestine? As we age, we don't absorb as well. We absorb all our nutrients in the small intestine. If you're not absorbing as well, it goes through. So in other words, your bowel movements may change. No longer do you have that nice formed poop. You may just have it in pieces or liquid. Make sure you check what comes out. You should check your urine. You should check your poop. Nothing wrong with looking at it. Sounds gross, but you may save your life too. So you look at it. Any bright red blood, black stools, stools that have no color to it. I've seen yellow, like a baby's poop, yellow, white. You can get lack of any of that bile that produces the brown stool. All those things you call the doctor. Certainly if you see blood, frank blood in a stool, most of the time it's due to hemorrhoids. Those veins that are around the rectum. Usually the hemorrhoids come because of chronic constipation. But nevertheless, if you see blood, you call the doctor. They need to look at it right away. Don't get put off. And so all that is in the GI tract. What about the urinary tract? Oh, I should mention, what happens too as we age, you tend to get constipation. Products to improve the constipation are a big seller, billion-dollar industry. And they're putting out fiber galore. They don't mention that you can eat all the fiber without buying all these other products. But nevertheless, I'm not against the pharmaceutical industry, although people take too damn many medicines. Over 70, 15 medications on an average people take. They're not all prescription meds. They may only take 3 or 4 prescription meds. All the others are over-the-counter products. Vitamins, probiotics, different types of minerals, all these other things that people are taking, omega-3s. They need them. Who said you needed them? Well, the actor that was on TV, he was he was an actor. He was paid to say that on TV. Don't listen to anything on TV. It's all baloney, all BS. Put out by the people who are trying to sell their product. And they're doing a darn good job at it. Multi-billion-dollar industry. So make sure you eat your fiber. Get your fiber from foods, vegetables, fruits. Get your fiber from food. The best way to do it, especially this time of year. The vegetables are coming out now. Enjoy them. Enjoy them. Okay. Also, before we leave the intestinal tract, diverticula. What's a diverticulum? It's a little outpouch that comes off the large intestine. You can get an infection in those little pouches called diverticulitis. The treatment of diverticulosis is fiber and plenty of liquid. treatment of diverticulitis, which is an infection, antibiotics. And you stay away from fiber for a short time till all the pain is gone, and then you can get back onto fiber again. I should have mentioned that with the GI tract. Urinary tract. People don't like to talk about these things. When you cough or sneeze, you may lose a little bit of urine, especially true with women. From childbirth, they stretched out all of their muscles down there. Now they're beginning to pay the price when they cough, sneeze, sometimes just talking. They'll lose a little squirt. So now they have to wear a pad. Big, big industry. All these pads that are put out, like just a regular pad, special pad, diapers, all these things now. Pads that you can put underneath on the bed. Big, big industry now. Billion-dollar industry. They're selling all these things. What can you do to try to improve things on your own? Number one, empty your bladder regularly, every 2 hours, whether you need to or not. Empty it regularly. Number two, try some exercises. They call them Kegel exercises, where you're squeezing your muscles down there, holding it to the count of 3 or 4, and then relax. You do about 10 of those, 3 or 4 times a day, Kegel exercises. They're not going to help everybody, but they help a lot of people. So, empty the bladder regularly, Kegel exercises. That's what you do. Okay. Losing urine. What about the men? Well, the men's prostate enlarges as you get older. Natural process, enlarges. It enlarges from the middle, not on the edges, but the middle. So it's squeezing that old prostate, the original prostate, squeezing it to the periphery, to the edges. That's why the doctor who sees you feels that prostate. Because if you're going to get cancer of the prostate, that's where it's going to be, in that original prostate that's been squeezed to the edges. That's why they can feel the bumps. I've seen people who go in to see their doctor and they've never had a rectal exam. I said, what kind of doctor did you see? That's part of your exam. You should always have that checked, always. Now, you may reach a certain age where cancer of the prostate's not a big deal. Like they say for me, I'm 80, okay? Is it a big deal now? No, because the incidence of cancer of the prostate is roughly about 1% per year. By the time I'm 100, I got a 100% chance of having cancer of the prostate. Is that going to kill me? No. It's so slow growing, you'll outlive that anytime. Do I even need to get a PSA, one of those blood tests for prostate? When I'm 80? Hell no. I'm not even going to think about it. So what if my PSA goes up a little bit? I could care less. As long as I'm able to pass my urine, I'm happy. A lot of products are sold out there to try to improve and shrink the prostate. Not too many of them work. Don't waste your money. Okay. The next thing we need to talk about, sex. No, my God, he's going to talk about sex. Yes, I'm going to talk about sex. It's always a part of your life. Why should it be any different? The elderly have sex. Nothing wrong with that. That's part of living. No big deal. Some people get embarrassed just talking about it. And you can imagine the billions of dollars that people spend, men spend, on drugs like Viagra, Levitra, Cialis, all these different drugs to try to retain their erection. Big deal. That's fine. If you need to do it, you can use that product. It doesn't usually hurt you. No negatives to it. It's fine. And if you enjoy it, use it. We all tend to have a lower testosterone, a lower level of all the hormones as we age. Men and women. Women later than men because they go through their menopause in their early 50s, late 40s. And then they quickly become just like the men as far as the hormones go. And hormones can help the women too. So it's not just a male thing. It can be a female thing too. Don't be embarrassed about it. Use the medicine if you need to. There's no downside to it. Okay. What else can we talk about? Joints, bones and joints. How many people have arthritis? 60% plus have osteoarthritis. Some of them have rheumatoid arthritis. Again, one of the highest selling things on the market, over-the-counter market, pain control. Pain control. Ibuprofen, naproxen, all these different medications. Now, CBD, cannabidiol, is trying to get in on the act too because they know it's a big market out there. Pain control. Take it for arthritis. Any proof that CBD helps? No big study has shown that. All the studies that they've done are all little studies. You got to understand that the marijuana is still federally illegal. And they've been a thorn in the side of all of the research people who want to do some research on marijuana, CBD at all. They were unable to until recently when they finally allowed some people to have research, true research done on marijuana. So it's going to be a few years, though, before we get to that point where we're able to do this type of thing. What about the nervous system? The nerves deteriorate too. I mentioned that we don't have that thermoregulatory thing in our bodies. It deteriorates in the brain too. If it happens to deteriorate in the central part of the brain where the hippocampus is, you may get some dementia. Now, dementia is not Alzheimer's. Alzheimer's, however, is a form of dementia. Dementia is a general term. It's a deterioration of mental capacity. Now, people think of memory first, memory. I think also, besides memory, I think of learning. One of the things that you can do to try to hold off a lot of these deteriorating neurons in your brain is learn something. Take a course. Anything. Just learn something. Read a book. Learn from it. Not just the usual trash book, but try a book where you actually have to think. You have to learn. Because that's really what a lot of this is about. It's about learning and then retaining. That's where the memory comes in. Learning and retaining. So we have now in the town, we have a committee to make Shrewsbury a dementia-friendly community. And we're going to have some programs on that here in the future as well. What else? Anything else? Yes, there are a lot of things. Social workers, when they come to see you as an elder person, they look at your activities of daily living, ADL, activities of daily living. In other words, can you wash yourself? Can you bathe yourself? Can you dress yourself? Can you go to the bathroom yourself? Can you feed yourself? Can you walk unassisted? Can you transfer from, say, a chair to bed or chair to walk? Those are the activities of daily living. There's also instrumental activities of daily living. Can you go shopping? Can you cook safely? Can you do your housework? Can you use your phone? Can you manage your money? Those are all instrumental activities of daily living. You got to be honest with yourself. If you can't do some of these things, there's some things that you can do while you still have the capacity to do it. You need to have somebody who is going to manage your money, your finances. You need to give them that power of attorney, usually somebody in your family. Also, you need to have a medical power of attorney in case something happens. Let's say that you have a stroke. How do you know you have a stroke? Remember, face, F, droopy on one side. A, an arm that's weak. C, which is really S, slurred speech. And then E, emergency, 911. That's the name that we give to people, all of the symptoms of having a stroke, face. The faster you can get somebody into the emergency room where they can give them something to dissolve a blood clot, usually it's because of a blood clot, the better your chances of having a full recovery. So remember those things as well. So face, that's important. Okay, what else happens? I said we're beginning to lose neurons in the brain as well as in our legs and arms and all. And they call that a neuropathy. Some of that neuropathy is perfectly legitimate, goes with the age, unfortunately. But a lot of it can be reversed. I mentioned one thing already. Learn. Keep learning. You should learn every day of your life. Very important to do. Learning. Exercise. I don't care what exercise. Simple walking. Remember those things that came out on the 10,000 steps? That sold a lot of Fitbits and different wrist things, pedometers, all these sort of things. That was a big business. It still is a big business.
Excuse me, Doc, we only got 50 seconds.
50 seconds, 10,000 steps. That's what they told you to take. You know, I don't know. I don't even know how many steps I take per day because it's all crap as far as I'm concerned. I exercise my 150 minutes a week. 150 minutes, that's what you need to do. So learn, exercise, and you need to be with everybody else. You need to volunteer. You need to be out there with people. Very good. That's all I got to say.
Very good, sir. Thank you very, very much. Everything was very interesting, and I hope that the audience in town was appreciative of everything you said, and I hope some of the fears have been laid to rest by some of the explanations you've depicted today. Well, I want to thank you very, very much for
It's
these
very
last
nice.
2 shows.
Well, I thank you for having me on and giving me such a broad, way of presenting it and all. We got in a lot of material.
Right. Good. Ladies and gentlemen, thank you for watching. I hope you enjoyed these 2 sessions we had. I hope you learned a lot. Thank you and good night.